is Dr. Kevin Costello. I'm an internist in geriatrician at Albany Medical College, and I do home care.
My name is Peter Aiello, and I'm a P3 pharmacy student.
Hi, my name is John Marafa. I'm actually the district pharmacy supervisor for the Walgreen Company. I'm a 2003 graduate of ACP.
I'm Tom Lavardi from the Systems Director of Pharmacy for St. Peter's Health Partners, which is a 4-hospital corporation in the Capital District.
My name is Erica Macera. I'm one of the clinical specialists at Albany Medical Center. I'm also the student coordinator. So all the students that come through our hospital go through me.
They need to go into these rotations with an open mind and ready to learn whatever they can. And if they're not learning what they want to learn, they need to ask, and they need to say to their preceptor, this is what I want to get out of this experience, how can you make that happen? And because that's ultimately the preceptor's responsibility to help them make their learning experience happen.
For our IPPE students, we know most of you have not stepped foot in a hospital, and we are more than willing to accommodate all of your learning experiences, but the things we really want from you when you come to us are to be inquisitive, ask a lot of questions. You're going to be in areas that you've never been in before. You're going to be sitting with a TPN pharmacist, so asking questions about how we calculate protein and how we calculate carbohydrates are so important. So for us, you're going to get the most out of your rotation when you ask a lot of questions.
Expanding on the student's willingness to learn, the student should be interested in learning and not just come to the site because it's an assignment. They should be able to work with the preceptor, providing high level of care, and provide an interest in the patients that they're providing care for.
The characteristics I look for in the IPPE students are professional bearing. In our situation, doing home visits, it's rather unique in that we're actually a guest in the patient's home, and so I look for the qualities of politeness and respect in the students, and patients generally have been very receptive of having the students in their homes because of that.
Attributes we're looking for in an IPPE student. One, they have to be very respectful for the environment of the hospital and the Department of Pharmacy, recognizing that we're a very busy department and recognizing that at times they may have to work independently, identifying projects that have been selected for them and working on those independently. Other attributes are they have to be a self-starter. They have to be able to work independently. Also, they have to work under the direction of a pharmacist and be respectful of that preceptor.
Our IPPE students are directly involved in our patient care and have a direct impact. So the stuff that we give you is not necessarily busy work as some of you may think it is. It really is drug utilization evaluations that adjust our protocols, that adjust our order sets and how we're going to treat patients. The drug information questions we give you are related to the actual patient that's going on. So when we ask you a question, you're doing the research behind it for us to go and talk to the doctors and the nurses to make a decision about how we're going to treat that patient at that time.
It was very scary at first, but in the end I became a much better pharmacy intern for it, and it made me want to come back to school and finish up my PTPM modules very strongly, because I knew that the knowledge I was going to gain in those was going to help me even further on APPE.
Pharmacy is a small world, and we know a lot of our colleagues, so if they had a poor experience with you, they always let us know.
It's important that students understand that pharmacy is a small world, and we do communicate amongst different chains, different organizations to find that proper candidate. The job market has changed so dramatically in the past 10 years that doing our due diligence will be the reason that we're successful and that we do hire that appropriate candidate for the position. When looking at candidates, the question's always posed, do you remember a student that did a rotation with you? And I think that the big thing is I remember every single student that has ever done a rotation with me, whether it was an IPPE or an advanced practice rotation that I'm currently hosting now. I know every single student, and I take the experience that they had when they come and apply for a job, or when we're talking to other preceptors or other colleagues. I had this person on rotation. How did they go? Or when I look at a resume, I see, they did a rotation at a Walgreens specifically, or a rotation, an administration rotation with a colleague of mine at a different company. I pick up the phone and I call and say, tell me about this candidate.
When we're assessing the student or the applicant who's been a student with us in our hospital or with any of our component hospitals in our corporation, we will rely on the interactions that we did have with them as a student. So if there was nothing but positive relation with that student, it's very important. If there's a negative relationship, that may reflect in the hiring process.
So when we're interviewing a candidate for a position at our hospital, and they have been in our hospital in the past, essentially everything that was done and said on that rotation influences our hiring decision. So it can be for the good or it can be for the negative. We've had a number of candidates who have come through who were amazing interns. They were motivated, self-directed, always went that above and beyond, that extra step. And for those, it's an absolute, you come in, we're going to interview you, and there's always that thumbs up to the director who does the official hiring. If we've had that poor experience with you, we always get the calls from the director before he brings anyone in, and for us it's I don't think they're going to work out for us. They just did less than bare minimum and didn't seem interested in being here at all.
Students have had a positive impact on the encounters in general, and that's another reason why the patients like to have them in. They've often provided me with very valuable feedback on my own prescribing habits with my patients, updated me on some newer information regarding some medications that have been in use for a long time, and they often provide me with requested information when I come across a question, or a patient will often ask a question, or a caregiver, as to what the appropriate thing to do is for a given situation involving medications.
The best example was a few years ago. I took one student at the time. Now I take pairs of two. But at the time, this student was all alone and was doing a rotation, and I had been called out of work for a special assignment that I was working on for the company. And I knew this student previously, and I thought the student was going to make an excellent candidate, and I really let them kind of go with the project, and what they delivered on this project was unheard of. I mean, stuff that the outcome of this project was well more advanced than I would have expected somebody that was on my salary to produce. So I think that some of the experience that I've had with students are very fantastic, and they do produce a lot of good outcomes. And I think that my rotation provides a unique opportunity for students to get the behind-the-scenes administration piece of it, and not the lick, stick, and pour pharmacy retail experience.
An example of a positive outcome from an IPP student. This happened several years ago when we had a IPP student who was assigned to review a new FDA medication safety warning for the Pharmacy and Therapeutics Committee, the medical staff. They reviewed it, and they were very brief, to the point, and as they presented it, our medical staff complimented them on how brief and how to the point they were in reviewing that safety review. After the meeting, the chairman of our P&T committee asked for the full review so he could then take it back to his medical practice and educate his co-physicians at his practice
For
site.
example, the DUE that we had a student look at was our IV Tylenol usage, not in the so distant past. So really that helped adjust our protocols. It now allows us to do a time restriction on how long that they're allowed to have it for, and it put into place our IV to PO exchange for our patients.